Good afternoon. My name is Quinn Hayes, and I am the Program and Grants Manager for Together Women Rise. And I'm super, super excited. It is my delight to have with us today Kaye Wattawa and Laury Bowman from Village Partnership. They're going to be telling us a little bit more about their organization and their work. So we're super, super excited to have them. Thank you so much for you guys both being here. It's my understanding that you guys have a short video that you'd like to share with us first. So we'll get started. I'll play that and then we'll come back to have our conversation. So again, thank you for being here and we look forward to learning more.
The rural areas of Ethiopia are extremely poor. Women face a spiral down to death. They have no access to health care. Without birth control, they give birth again and again. Without skilled assistance at the time of delivery, many die in childbirth and many more are left with serious gynecologic complications of childbirth. My name is Margaret Muldrow, but everybody calls me Migs. I'm a dermatologist. I grew up in southwestern Ethiopia. When I was a child, we ran a clinic way out in the bush. And one day, a woman came in labor. She'd been in labor for multiple days, and she was in terrible pain. He put her on the single exam table that we had and found that the baby was dead and stuck in the birth canal. He pulled it through the birth canal. The woman thanked him for relieving her pain. They drank tea together, and then she died. And I never forgot that. It's probably why I became a physician, but also why we're working in women's health in Ethiopia today. We started the Village Health Partnership in 2010. We're a 501c3 nonprofit organization that works for safer motherhood in rural Ethiopia. Our mission is to prevent maternal and neonatal death in childbirth and to treat and prevent gynecologic complications of childbirth. We searched for a way to intervene in the crisis that women face in maternal health. We met Wattawa. We found her in her hut waiting to die. She had a fistula and was incontinent of urine. She was severely debilitated. She could no longer care for herself and her family. And as an organization, we facilitated her treatment. So in treating Wattawa, we sent a ripple effect through the community. We saved her life, we lifted up her family, and we benefited the entire community. Unfortunately, in the rural areas of Ethiopia, health facilities, if they exist at all, are deadly places to deliver. They're extremely unsanitary. There is no water, they don't sterilize instruments, open defecation is common, they have no infrastructure for maternal health, and medical providers on the front lines don't have the skills to facilitate a safe delivery. We aim to create health systems of care that give women access to clean, safe, and effective health care. We have 3 areas of program focus. The first, we have a screen, transport, and treat program for women with gynecologic complications of childbirth. We identify the women in need in the rural areas, transport them to Ira Hospital where they undergo surgical treatment, and then we transport them home. The second program that we have is our water sanitation and hygiene and maternal health initiative. We've targeted 14 healthcare facilities in rural southwestern Ethiopia where we're implementing access to clean water, measures for sanitation and hygiene, and infrastructure for maternal health. And then our third program, we have education and training programs to create a strong, skilled, confident workforce on the front lines in rural Ethiopia. Our first education and training program, we provide village women with scholarships if they wish to become nurse midwives. The second program is our nurse midwife mentorship program. Nurse midwife trainers go out to each of 8 healthcare facilities 4 times a year to skill check and train nurse midwives on the spot. They also provide mentoring. If women are found not to have enough obstetric skills, we refer them to our third program, where they get 3 weeks of intensive skill building in emergency maternal, obstetric, and neonatal care. All of our programs aim to build health systems of care that give women access to clean, safe, and effective health care at the time of delivery. It is our hope that one day mothers and babies won't die in childbirth and women won't suffer needlessly from gynecologic complications of childbirth. Your donation in any amount will enable us to continue to work for safer motherhood in rural Ethiopia and ultimately reach this goal. Thank you so very much for your support.
That's amazing. Thank you so much for sharing that amazing video. We definitely want to learn more. We're so happy to have you as our May mentee. And so before we get started with our questions, I just want to take a moment for you both to introduce yourself and tell me about your respective roles within the organization. So Kaye, we'll start with you. If you can introduce yourself.
Yeah, thank you so much for having us, Quinn. We're honored to partner with Together Women Rise. So I'm Kaye Wattawa. I'm the development coordinator at Village Health Partnership. I've been with VHP for about a year now. And I work pretty closely with our founder and president, Miggs, who you just heard speak in the video. And I do a variety of different things, but focus on communications and some help with finance work as well.
Wonderful. Thank you. And Laury?
Good afternoon. And again, echo Kaye's thanks. It is really, truly a privilege to have a conversation with Together Women Rise this afternoon and to share our Village Health story. I am presently the chair of the board, and I'm also the leader of the organization's governance committee, which roughly means that I craft all of our memorandums of understanding that surround each of the different initiatives that we undertake.
Wonderful. Thank you so much, Laury, for sharing as well. Well, we'd love to learn more. So let's get into our conversation now. So we'll start off with our first question, and it's really around, let's begin with the issue. The video did a wonderful job depicting the issues in Ethiopia and the impact that it's having on the health of both mother and baby. So tell me a little bit more. Tell me about your organization and why this funding has helped to both inspire and shape your work around maternal and neonatal mortality, and why it's so important. Hey, if you want to share.
Sure. So as Mig said in the video, Ethiopia has one of the highest maternal and neonatal mortality rates in the world. It's also one of the poorest countries in the world. And we work in those areas that are severely underserved. So we have a couple different sort of buckets of programs that we work in. The first thing that we started doing when BHP formed in 2011, I believe, was the screen, transport, and treat. So treating women who have gynecologic complications of childbirth because they don't have this skilled assistance at delivery, they don't have access to healthcare, and if they do, it's oftentimes more dangerous to deliver in a health facility than it is to deliver at home. So after doing that for a while, the organization realized that we needed to also work in prevention. So now we work, we have a programs under WASH and maternal health, and that's really working on capacity building. And then lastly, we have education and training, which is what Together Women Rise is partnering with us on. So a few years ago, we did a survey of local health clinics in this area of Ethiopia that we work, the West Omo zone. Sorry, not a survey, a skill check for nurse midwives who are working there. And all of the nurse midwives flunked these skill checks. We were assessing things like the ability to resuscitate a neonate who's not breathing, So it became clear that we needed to have more direct intervention, mentorship, and training opportunities for these people who are working as nurse midwives. So that's our skill check training and mentorship program that we're working with Together Women Rise on.
Wow, wonderful. That's so impactful. Thank you for coming in and doing the work that you do, seeing it's so needed in that area. What a gift. Laury, did you have anything to share before I move on to the next question?
I would add from the larger vision that to have a complete system of healthcare, it requires people who are adequately trained to deliver the services that women need. And this was part of our needs assessments that we do every year. As Kaye mentioned, we started out with a skill check in collaboration with the health centers that women would go to arrive at that shared identification of an opportunity to create that skilled assistance, changing outcomes, and increasing confidence in the healthcare system overall.
Yeah, amazing, amazing. We look forward to getting more stats about maybe where they began and how your program has impacted that very skill check today. We'd love to learn more. As you have reports and you look back at data, we'd love to hear about where you began or where Ethiopia began, and then the impact of what your grant has been on the midwives. The next question is, I'm curious, tell me how the wider community, whether it be villagers, men, leaders, or how the women themselves have reacted to the programs that you're offering and the work that you're doing in Ethiopia. Or if there's a story that you'd like to share, please take this opportunity to do that as well.
Kaye, I'm happy to lean in. I can share a couple stories from the lens of the women who have been through the program. So during one visit to Ethiopia, Dr. Miggs and I went to a health center to interview a small number of women who had been through the program. And over 50 women traveled for more than at least a day, if not 2 days, to come and express their profound appreciation for the care they received through the program. And it was overwhelming. To your point about men, in another story, a number of us traveling on one of our annual visits, we were invited out to an extraordinarily remote home of a husband and wife who were beekeepers as they're farming. And they treated us to a ceremonial bowl of honey. And they were both in tears, expressing their profound appreciation for the fact that Village Health Partnership through the program saved the wife's life. From one step removed, the clinicians we partner with are deeply grateful, both from the opportunity to teach and the opportunity to receive education, because it increases their confidence that they can provide the care that they're passionate about being in the rural communities to deliver. And the overall communities recognize that by doing what we do, by creating that competent, safe system of care, the community thrives because women's lives are not lost.
Absolutely. Laury, thank you. That must have been so impactful for both you and Miggs. There are things that will shape your life and touch you for forever. And I'm sure that's added to your list to see all those women and that husband and wife that shared that. Kaye, is there anything that you wanted to add as well to that?
I would just say, kind of to piggyback on what Laury said, that a lot of the people in leadership roles in the community that we need to work with in order to do the work that we do are men. And so, we've definitely been successful through their cooperation support, and eagerness to do this work as well, because it really does have a positive impact on the community as a whole.
It does. So often we talk about the organizations, and that's amazing because without the organization, this work wouldn't exist. But I'm always curious about the people who are behind the work. What is your why? What drew you to it? Whether it's an employee or a board member, there's so many nonprofits and initiatives that speak to us. So can you share with me and our members about your why and what drew you to what you're doing and involved in now through VHP? Kaye, you want to start us off?
Sure. Yeah, I'll start. So I've always been a fan, sort of tried to make sure I was doing service-oriented work. It's really important to me personally just to feel like I'm having a positive impact on the community, on the world at large through the work that I do. I was lucky enough to have a connection to the board. And I, through that connection, learned more about VHP and could tell that, it's a sort of organization that's small, but has a really big impact. So that was really inspiring. And then after having met with Migs, who I work pretty closely with, I was impressed, and definitely could tell that her leadership really allows the organization to move forward and to do really good work. So that's a little bit of the background and my why.
Got you. Thank you. Laury?
Certainly. So about 21 years ago, I had my own experience of a challenged delivery that turned out well 21 years later, but I was an inpatient for 9 weeks. And when Dr. Miggs came and approached me to ask for what at the time had been an insurmountable hurdle for VHP, they couldn't find a volunteer lawyer that would help them. So with my experience with Miggs's delineation of the problem, I could not say anything but yes. I will dive in with both feet. And her vision for what was the art of the possible over a decade ago in rural Ethiopia, a part of the world that gets little attention for any cause, let alone women's health. I've stayed because what we've done, we're ready to move the needle.
Mm-hmm. So true. My background is public health, so I totally am in agreement. It's so impactful to hear that. Thank you both for sharing and really having the attitude, here I am, send me. I can't thank you enough for saying, raising your hand and saying, here I am, send me. So the next question is really, what can we expect in the future to see from Village Health Partnerships? Like, is there a program, a pilot? Are you seeking to expand? Can you tell me a little bit more about what we can expect from you?
So as part of our kind of, one of our goals is creating this safe, clean, and effective system of care in this area of Ethiopia where we're working. We're doing some exciting things currently. For example, one of the district hospitals, it's the only hospital that's able to provide emergency obstetric care or C-sections to about 700,000 residents. They have intermittent power at their hospital. They have a generator that goes out occasionally. So we've been working with our partners to actually build a solar power system for that hospital so that they can reliably provide this care. So that's one example of how we're kind of working to provide this safe, clean, and effective system of care. And there's a lot of work to be done, in the area where we're working to that end. So we'll definitely continue in that. There's also, I mentioned, and this isn't one of the programs that Together Women Rise is working with us on, but our first program, our Screen, Transport, and Treat program that works to treat gynecologic complications of childbirth. We have noticed a need that sometimes women need continued care after being treated for obstetric fistula or pelvic organ prolapse. And so we're actually starting a rehabilitation program where women can receive continued care after those operations to ensure that they're going back home healthy.
Wonderful. Thank you. Exciting future. Laury, did you have anything that you wanted to add?
One other thing I would add to what Kaye described, and this is where we are really advancing the art of the possible under Meg's leadership, is we are working on consistent data collection for nurse midwife skills, where our clinical partners, as Kaye mentioned, go out and train, and we have the ability to systematically assess where are people's skills, where do they need additional interventions, what can we do to support mentorship relationships, so those women who are nurse midwives or men who are nurse midwives out in the truly remote, fragile areas where the health centers are can contact individuals, providers at the health centers that are district hospitals and even the regional hospital to get that peer clinical support in the moment to really lift up the level of care available.
Wow. Innovation at its finest. Can't wait to see and hear more about that.
Where it's in process, not quite there yet, but that's what we can expect to see in the future.
Very nice. Well, ladies, we have a few more minutes. Is there anything else that maybe I didn't ask a question about, or something else that you wanted to share before we get ready to close out our conversation with our members or with Together Women Rise?
And I just want to share our profound appreciation for the opportunity for the conversation and to help spread an awareness of both what is it like to be a woman who's confronting these clinical situations in rural Ethiopia, and what the art of the possible has been under the leadership of a committed doctor like Dr. Miggs and a group of us making up the nonprofit Village Health Partnership.
Wonderful. Well, Kaye, I didn't know if you had anything to share before I close this out, but I want to just extend that to you as well.
Yeah, I guess I'll just share just a little bit about my excitement about this particular program and those dealing with the nurse midwives in the community. I think it merits mentioning that, these are super brave, frontline workers who really don't have a ton of support. They, have a couple of years training program that they need to go through to be certified, but then they're sort of left to their own devices. There's not, a supervising physician in those areas, in the super local health clinics. So I just think it's a wonderful opportunity to impact the community at large. Like, we know there's research that the more education that women in a community receive, kind of the better off the whole community is. It's a really, really powerful tool. So not only are we increasing the skilled assistance at the time of delivery to take care of mothers and babies, but we're also having this ripple effect on communities, which is very, very inspiring.
Very inspiring. I think it's beautiful how Megs puts it, the art of the possible. And that's what you both have shared with us today. And we're so hopeful about your future and the work that you're going to do. We're keeping our fingers crossed to you for what's to come in the future. And I just want to say again, Kaye and Laury, on behalf of Together Women Rise, we're so grateful to be in partnership with you and really learning about what it means to be in community with supporting grantees such as yourself. So we can't thank you enough for sharing the work, the vision, and the future aspirations for what you hope to do with impacting more women and babies in Ethiopia. So thank you again. And again, everyone, we look forward to seeing you all next month for our next feature. And without any further ado, if hearts and minds are inclined and in step, we're going to end and say thank you again. So have a great one. We'll see you next month.